Most people think working in an emergency room is about chaos, alarms, and constant life or death decisions happening every second. And while that part is real, what most people don't see is everything in between. The constant pressure, the emotional weight, the mental exhaustion that builds quietly over the course of a shift. Because being an emergency room nurse isn't just about reacting to emergencies. It's about staying ready for them at all times, even when nothing is happening, especially when nothing is happening and the day begins long before the hospital is fully awake, usually in darkness, when the world outside is still quiet and most people are asleep, but inside the nurse's mind the day has already started, thinking about the last shift, wondering what kind of patients will come in today, because there is no predictable schedule, no guarantee of what the next 12 hours will bring. And by the time the nurse arrives at the hospital, the energy is already different from anywhere else. There's a constant movement, a sense that something is always about to happen, and stepping into the emergency department feels like stepping into a place where time doesn't move normally, where minutes can feel like seconds, and seconds can feel like minutes, depending on what's unfolding. And the first task is always to get updated, to understand what's already in motion, receiving. Handoff reports from the previous shift, listening carefully as another nurse explains the current patients, their conditions, what's been done, what still needs to be done, because continuity is critical. Mistakes happen when information is lost. And in this environment, mistakes aren't just inconvenient, they can be dangerous. So every detail matters. Every medication, every symptom, every changing condition. And once that handoff is complete, the nurse takes a moment to look around, scanning the room, seeing who is stable, who might not be, which beds are occupied, which ones are about to be filled, because in the emergency room, empty space never stays empty for long, and even before the shift fully settles in, the first patient arrives, sometimes walking in, sometimes brought in by ambulance, and the difference between those two often tells you everything you need to know about how urgent the situation is. And as the patient is brought in, the nurse immediately shifts focus, assessing quickly not just what's obvious, but what might not be. Checking vital signs, asking questions, observing behavior, because the first few minutes can determine everything that follows, and there's no time to hesitate. Decisions have to be made quickly, but accurately. Balancing speed with precision in a way that becomes second nature over time. And as one patient is stabilized, another arrives, and another, because the emergency room doesn't wait for things to calm down before introducing something new. It stacks situations on top of each other, forcing the nurse to manage multiple priorities at once, keeping track of medications that need to be given, tests that need to be ordered, results that need to be reviewed, all while remaining present with each individual patient, because to them this isn't one of many cases. It's their emergency, their fear, their pain. And the nurse has to treat it that way every time, no matter how many times they've seen something similar before. And this is where the job becomes more than just clinical skill. It becomes emotional control, because not every situation ends. Well, not every patient improves, and sometimes, despite everything that's done, the outcome isn't what anyone hoped for. And the nurse has to carry that while still moving forward, still caring for the next patient who needs help, because there is always another patient, always another situation unfolding, and as the hours pass, the pace doesn't necessarily slow down, it shifts, sometimes into brief moments of quiet that feel almost unnatural, where the room is still, monitors steady, conversations softer, and for a moment it feels like there might be time to breathe. But those moments never last long, because the emergency room exists in cycles, calm followed by chaos, followed by calm again, and the nurse learns to use those brief pauses not to relax completely, but to prepare, to restock supplies, to review charts, to double-check medications, to anticipate what might come next. Because being prepared is the only way to handle what you can't predict, and when the next wave hits, it often comes without warning, multiple patients arriving at once, different conditions, different levels of urgency, forcing the nurse to prioritize instantly, deciding who needs attention first, who can wait, who requires immediate intervention, and these decisions aren't always easy. They require judgment, experience, and sometimes instinct, because there isn't always time for complete information, and in those moments the nurse becomes part of a larger system, working alongside doctors, technicians, other nurses, each person playing a role, communicating constantly, adjusting as situations change. Because in the emergency room, nothing stays the same for long. A patient who seems stable can suddenly decline. Someone who walked in can suddenly become critical. And the nurse has to be ready for those shifts at all times, watching closely, noticing subtle changes, because catching something early can make all the difference. And as the shift continues, the physical toll begins to show: hours of standing, moving, lifting, constantly alert, but the mental toll is often heavier. The constant awareness that every decision matters, that every action has consequences, that there is no room for distraction, and even something as simple as documenting care becomes part of that pressure, because everything has to be recorded accurately: every medication, every intervention, every observation, not just for continuity of care, but because it becomes part of the patient's record, something that can be reviewed, questioned, relied upon. And as the day moves forward, the nurse finds themselves moving between extremes, from moments of intense urgency where every second counts to moments of routine care that still require full attention. And that constant shift can be exhausting in a way that's difficult to explain, because it's not just physical effort, it's mental switching, adapting over and over again without pause. And yet, despite all of this, there are moments that stand out, moments where a patient improves, where treatment works, where someone who arrived in distress begins to stabilize, begins to recover, and those moments matter. They provide a sense of purpose, a reminder of why the work is done, even when it's difficult, even when it's overwhelming. And as the shift continues into later hours, the environment changes slightly. Not in pace, but in feeling. Fatigue beginning to set in, concentration requiring more effort, but the expectations remain the same. The standard doesn't drop just because the nurse is tired. The care has to remain consistent, precise, focused, and as more patients come in, the process repeats. Assessment, intervention, monitoring, documentation, over and over again, each time requiring the same level of attention. Because there is no such thing as a minor moment in this environment, every detail has the potential to matter. And as the nurse moves from one patient to the next, the day continues to build layer upon layer of responsibility, each one adding to the overall weight of the shift. And even as time passes, the sense of unpredictability never fades, because at any moment something new can arrive, something that changes everything, something that demands immediate action, and the nurse has to be ready for that at all times, mentally, physically, emotionally, prepared to step into whatever situation comes through those doors next without hesitation, without delay, because that's what the job requires. And as the hours continue to move forward, the nurse begins preparing for what comes next. Not the end of the shift, but the continuation of it, because in this environment there is no clean break, no clear point where everything is resolved. Only a constant flow of situations that need to be handled, one after another, each one carrying its own level of urgency, its own level of importance. And as the shift moves deeper into the day, the nurse remains in that flow, fully engaged, fully responsible, knowing that what happens next is just as unpredictable as everything that came before, and that at any moment the situation can escalate in ways that require immediate and decisive action. And as the shift pushes deeper into the day, the rhythm of the emergency room becomes even more unpredictable, because just when it feels like things might stabilize, when the current patients are managed and the immediate needs are under control, something changes. The sound of incoming ambulance sirens growing louder as they approach, the radio communication alerting the team to what's coming in before the doors even open, giving only seconds to prepare. And in those moments, the nurse doesn't think in long sentences or careful plans. Everything becomes immediate, instinctive, driven by training and repetition, because when a patient is wheeled in on a stretcher with urgency written all over the faces of the paramedics, there is no time to ease into the situation. It's immediate. Assessment, immediate action, checking airway, breathing, circulation, listening for key details from the paramedics while simultaneously beginning interventions. Because information and action have to happen at the same time, not one after the other, and as the room fills with controlled movement, with voices communicating vital signs, medication needs, procedures being prepared, the nurse becomes one, part of a coordinated effort, moving with purpose, anticipating what will be needed before it's even asked for. Because hesitation in these moments isn't an option, and as quickly as the situation escalates, it can either begin to stabilize or continue to decline, and the nurse has to adapt to either outcome without losing focus. Because even as one critical patient is being managed, there are still others waiting, still others who need care, and that's one of the hardest parts of the job. Knowing that attention has to be divided, that prioritization isn't just a choice but a necessity, and sometimes that means stepping away from one situation to address another, trusting the team to maintain what's already in progress while shifting focus where it's needed most. And as the hours continue to pass, the accumulation of everything that's happened begins to settle in, not all at once, but gradually. A sense of fatigue that builds beneath the surface, because the body can keep moving, can keep functioning on routine and adrenaline, but the mind carries every interaction, every decision, every moment where something could have gone differently, and yet there is no time to dwell on any of it because the next patient is already there, already needing attention, and so the process repeats. Assessment, intervention, monitoring, communication, documentation, over and over again. Each cycle blending into the next, creating a flow that is constant and unbroken. And within that flow, the nurse continues to balance not just the physical tasks of the job, but the emotional ones as well, speaking to patients who are scared, to family members who are overwhelmed, explaining what is happening, what is being done, what might happen next, and doing so in a way that is clear but also reassuring, because in the emergency room, information alone isn't enough. People need to feel that someone is in control, that someone understands, and that responsibility often falls on the nurse, who becomes not just a caregiver but a point of stability in an environment that feels anything but stable. And as the shift moves into later hours, the cases begin to vary even more. Not just critical emergencies, but a wide range of situations, injuries, illnesses, complications that all require attention, and each one demands a different approach, a different mindset, because what works for one patient doesn't necessarily work for another, and the nurse has to adjust constantly, switching between different types of care without hesitation, without losing accuracy, because consistency is key even when the circumstances are not. And as this continues, the importance of teamwork becomes even more apparent, because no single person manages everything alone. The emergency room functions as a unit, with each member relying on the others, communicating continuously, updating each other on changes, asking for assistance when needed, offering support when someone else is overwhelmed, because the workload is not evenly distributed. It shifts constantly, and being able to adapt as a team is what allows the system to function at all. And within that system, the nurse remains at the center of patient care, the one who maintains continuity, who tracks progress, who ensures that nothing is missed as situations evolve, and this requires a level of attention that doesn't fade. Even as exhaustion begins to set in, because fatigue doesn't reduce responsibility, it only makes it harder to maintain, and yet it has to be maintained because the stakes remain the same regardless of how long the shift has been going. And as the night begins to approach, the atmosphere changes again, not necessarily becoming quieter, but becoming different. A shift in energy, in pace, in the types of cases that begin to come through, and the nurse adjusts once more, continuing the same process, the same cycle of care. Because there is no moment where the job becomes easier, only moments where it becomes different. And throughout all of this, there are small moments that stand out. Brief interactions, a patient expressing gratitude, a family member showing relief. Moments that don't change the overall intensity of the environment, but provide a sense of connection, a reminder that behind every task, every procedure, every decision, there is a person whose experience is being shaped by what is happening in that moment. And those moments matter, even if they are brief, even if they are quickly replaced by the next demand, because they add meaning to the work, they reinforce why the effort continues even when it becomes overwhelming. And as the shift continues further, the nurse begins preparing not for an end, but for a transition, because the responsibility doesn't disappear when the shift ends, it is passed on, handed off to the next nurse who will continue the process. And this handoff is just as critical as the one at the beginning of the day, because everything that has happened must be communicated clearly, accurately, completely, ensuring that nothing is lost, nothing is misunderstood, because the next decisions depend on that information. And as the nurse goes through each patient, explaining their condition, their progress, what has been done, and what still needs to be done, there is a sense of closure, not in the sense that the work is finished, but in the sense that it is being continued, that the responsibility is being transferred without interruption. And once that handoff is complete, the nurse steps away, physically, leaving the environment, but not entirely disconnecting from it, because the experiences of the shift remain in memory, in thought, in the quiet moments that follow, and as they leave the hospital and step into a world that feels slower, quieter, more predictable, there is a contrast that is impossible to ignore. Because inside the emergency room, everything is immediate, everything is urgent, everything matters all at once. And outside of it, life continues at a different pace, one that doesn't carry the same constant demand. And yet, even in that contrast, the nurse knows that the cycle will begin again, another shift, another set of patients. Another series of situations that require the same level of attention, the same level of care, because being an emergency room nurse is not defined by a single day, but by the repetition of many. Each one different, each one unpredictable, each one carrying its own challenges and its own moments. And it is within that repetition that the true nature of the job becomes clear. Not a series of dramatic highlights, but a continuous commitment to being present, being capable, and being ready for whatever comes next, no matter how expected or unexpected it may be.